dogs have a great purpose. Their role is to love you every single day. And when they leave you a better person, and they become stars in the sky. I was 5 days old when I met my best friend. He was a beautiful Rottweiler named Samson. We did everything together. We went to the beach.
Come on, Sam.
We went to parks. And we read stories together. Then my baby sister was born, and we played together all the time. We loved having a Rottweiler. They are working dogs, like the Portuguese water dog and the husky. They can herd sheep and cattle, they can pull carts, they can pull sleds, and they can do sports like agility, tracking, and dog diving. Their ancestors were the drover dog for ancient Roman armies. They pushed the cattle that provided food for them. The army traveled through the Alps and settled into the border region of Switzerland and Germany, which became known as the town of Rottweil. Rottweil was known for its open-air market. The Rottweiler was known as the butcher's dog because they were used to pull carts to the market for the butcher. Today, Rottweilers are used as search and rescue dogs, as therapy dogs, and as service dogs. We were proud to have a Rottweiler. One day, Samson started limping. He didn't want to go on hikes anymore. My mommy knew something was wrong, so she took him to the veterinarian. The doctor said Samson had bone cancer, osteosarcoma, the same bone cancer that children get. Oh, Doo-doo. He was in great pain. His leg was becoming weak. The doctor said we would have to amputate his leg and give him chemotherapy. This made my mom and dad cry.
Edie, honey. Edie, his little leg is hurting. And that's why we're not sure, because the vet said we might have to take one leg away.
No.
It's to make his leg feel better. They might just have to take one leg and he'll feel better.
No.
You don't want them to?
When your dog has osteosarcoma, you can amputate the leg. That's the best way, or it's the only way to remove the primary tumor. So what that means is we want to remove the tumor before it spreads. If you leave it in place, then you have a higher risk of it spreading. So if you catch it early, perhaps your dog would not get metastatic disease, so spreading of the cancer, but your dog would have to live with 3 legs. And we now know that living on 3 legs, lots of dogs do very well with that, but it does affect all their other joints. It affects their gait.
We heard about a Rottweiler in Colorado. He was living a happy life with 3 legs. His name was Squirt.
He was laying upside down and I was rubbing on his legs and I felt a little bump. And at first it didn't look like anything. And what was it, about 4 or 5 months later, it just kind of blew up. And
Looked like a Popeye arm.
and you could,
Really,
yeah.
that's what it was. It kind of just,
right.
and he started limping a lot more at that point.
Yeah, the limping got real bad and took him back in, and it was actually outside of the bone. It was not internal. And it came back osteo with a grade 2. They grade cancers on 1, 2, 3, and 4, and his was a grade 2.
When I see them, they have 3 legs because they've already had their amputation. And that's usually the first and foremost thing that is done all over the United States.
And that's the thing. It was just his leg that was sick. You take the leg, you take the cancer. And we took the cancer. When I make breakfast and dinner, Squirt would always bark, 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 and have this fit till he got dinner. And I didn't realize about 3 months prior to his amputation, he had stopped that. It wasn't clicking until about 2 weeks after his amp, and he was starting to feel better. All of a sudden, he started jumping up for food again, and then the barking started, and it was his whole personality came back. We started the molecular 2 weeks prior to his amputation. Our vet wanted to get any cancer cells that could have been floating around prior to the amp.
That's what we're working on right now with the new treatment theory of immunotherapy. That's what we're trying to get, the theory of getting the immune system to actually go and identify malignant cells and attack them.
With Squirt, since his cancer was just in his limb, it didn't make any sense to go down that path of doing a chemo afterwards just to go ahead and damage good cells in him. This molecular, it takes care of the bad ones. And that's all that we need to do is get rid of the bad things. And he brings a lot of good things to our life.
Yeah, and this is his molecular that helps remind his body to get rid of the cancer cell.
That is the concept of just awakening the immune system to be finding those cancer cells and then killing them.
It's kind of a protein that attacks the cancer cell only, and because cancer cells are immature cells, it basically destroys them without harming any of the immune system. There's no side effects.
Well, he's happy.
Yeah, I mean, it leaves his immune system intact to help fight anything else. Whereas chemo breaks down the immune system, the dogs can get something, can get a secondary infection. And we are lucky enough that we live close enough to have this alternative treatment. Right now, he's still on a high dosage of his molecular. He's still on the rush dosage because he was a grade 2. That hopefully over time will reduce, and he won't have to have as many shots. He's still on his raw diet.
Out in the wild, they don't cook much of their food, so they're eating what they normally would eat.
If I can get one person some information that may help their dog or get a vet interested in doing more studies, because not only is it for the dogs and the cats and the horses, but humans. And that's the thing. It's like what we learn from them that can help us. And he fought this animal as a survivor.
Then we learned about another special Rottweiler in Colorado. His name is Brutus.
I first heard about Brutus on Facebook. I reached out to Laura and asked her some basic questions about what was going on and what his special needs were. And she put me in touch with the home that had him at the time. And that family told me his entire backstory, which was that he and his litter mates were being offered for sale in a parking lot. And they had said, they admitted that he had gotten frostbite as a puppy and that they had actually amputated his feet at home. The very first time we met him was at OrthoPets, and it was about a week before he had revision surgery on his paws.
OrthoPets is a company built on the idea that animals, regardless of species, can receive the same type of orthotic or prosthetic solutions that we have available for our human patients. So the whole idea is, how can we help our dogs, cats, our pets, our beloved family, friends thrive and just really have a great, comfortable quality of life through orthotics and prosthetics.
He reminded me of a foal that was just standing up for the first time. Surprisingly, he did take to his rear prosthetics very quickly. I don't think he thought about it in the way that we as humans think about it, but I think just the ability for him to look out at the world and to say, I want to go and smell that tree and actually be able to walk over and do it, it was probably an amazing experience for him. I mean, he's being a dog in that sense. He's enjoying the world. The most rewarding thing for me has been just seeing his personality blossom and his self-confidence develop. That was huge. I mean, seeing him from when he came in to being shut down and scared of so many things to being a confident dog in the household. We're still doing work outside of the house and all of the stimulation that he's not used to. But even in that regard, he has come such a long way, such a long way.
Let's just see how he's doing. Thank you, mister. Okay, now, another little walk.
Good boy.
And let's see about going over this transition here. I'll wait here, let you guys pass. But let's watch the transition here. Okay, off you go. My human career was based in orthotics and prosthetics, wheelchair seating, and some really other interesting things. But I had the pleasure and the honor, really, to work with children, working at a Shriners Hospital and experiencing how you could treat a patient, how you could deliver a prosthesis or an orthosis to a little kid who really can't tell you how it feels. Does it feel better, worse? Can you play basketball with your buddies or not? So that ability to hone my clinical skills with children, receiving these same types of orthotic and prosthetic devices that we use for animals, really helped me transition when I had the opportunity to do so, to work with my animal patients who are just as enthusiastic about life as the child is, but also not able to communicate what they feel and what they're experiencing. I really felt this drive to do something creative with my skills. And in the human side, there's a lot of really neat opportunities, absolutely, but I just wanted to try to take on a new challenge. I wasn't certain what the challenge was, and then that challenge just fell into my lap. My cousin's dog had a similar injury to what we would experience in the human field, a stroke, and instead of having my cousin's dog's leg amputated, we decided, hey, maybe we could make a brace, just like we make a brace for my human patients. And sure enough, that worked. And that just segued into a lot more of these, what I would call routine types of solutions for humans, but just applying it to animals. So that challenge that fell into my lap was just the blossoming, opening opportunity for me to say, hey, I bet we could do this, and how come we're not already doing it?
Animal rehabilitation is really the marriage of veterinary medicine and human physical therapy. When you combine a veterinarian with a human physical therapist, all of a sudden, you create all of these options for animal owners and for the pets.
Good boy.
Now, after a dog has had surgery, as soon as the dog has good pain management, that dog is up and moving. We're using their muscles and teaching their body to move again. That's a practice that's very common in human medicine. And the veterinarians are learning to say, oh, these dogs look better when we get them up and move them sooner, so that they're not getting secondary deconditioning effects, secondary weakness, secondary pain. I've never seen a dog who's lost its resilience. Even dogs who have terminal cancer, who have pain, they still love to please their owners and go out into the world And so our job as rehabilitation therapists is to supply the owners with options to let them continue to share life with their dog. We have this whole spectrum of things that improves the quality of life for an animal, which then improves the quality of life for the owner. And it really doesn't matter what the diagnosis is, because a dog's spirit is always intact. I met Brutus the Rottweiler last year. His foster mother brought him up to CSU because we were practicing moving him around in his prosthetics. One of the challenges for a dog who has 4 prosthetics is that every step they take with a prosthetic on changes the mechanics all the way up their limb and through their entire body. So it takes a tremendous amount of bravery from the dog's part to choose to move with the prosthetic on because it's totally different. So Brutus is the kind of dog who doesn't just accept the prosthetic. He's the kind of dog who's brave enough and resilient enough to try a myriad of other things. And in that process of learning, there's a lot to be said about learning to speak dog from a human's perspective. And Laura's so good at looking at Brutus and saying, he's done, he's tired, he doesn't want to do anymore. And it's important to respect the dogs when they get to that point, because they in turn then will respect what you ask them to do, because they know that you hear them.
When I first met Brutus, I saw a dog that was an amazing dog with an amazing spirit that obviously has gone through a lot. And Brutus was actually the inspiration for me to start this study with prosthetics in dogs. And Brutus is a great example of when we think outside the box where we can make a difference.
It would be hard to walk with one leg. If these dogs can live a happy life, maybe Samson can too. I asked the doctor, why do dogs get cancer?
The exact cause of canine cancer, such as osteosarcoma, is unknown. The larger breeds, like the Rottweiler, Great Dane, Irish Setter, Doberman Pinscher, German Shepherd, and Golden Retriever, are at greater risk of contracting osteosarcoma due to their size and weight. Cancer occurs when the body's immune system cannot stop cells from replicating at an abnormally fast pace. This forms a mass known as a tumor. According to several international veterinarians, there is no single factor that contributes to cancer. The primary factor is genetics and poor immune system. But there are environmental factors that can contribute to canine cancer: outdoor and indoor pollutants, pesticides, herbicides, fertilizers, indoor cleaners and paints, secondhand smoke. Dogs living with owners that smoke inside are up to 2.5 times more likely to develop lymphoma. According to Dr. Larry Glickman, in a smoking household, long-nosed dogs are twice as likely to develop nasal cancer, and short-nosed dogs are twice as likely to develop lung cancer. Insecticides. Female dogs exposed to insecticides in flea sprays and dips are at a higher risk of developing bladder cancer than those on whom such products are not used. Excessive sun exposure. Dogs most susceptible to skin cancer have fair skin, white hair, or short hair. And the most controversial, but also the #1 contributor, is commercial dog food. Chemicals and preservatives have been known to cause these cancers in dogs: kidney cancer, bladder cancer, skin cancer, stomach cancer, spleen cancer, and leukemia. According to Dr. Lisa Newman, the huge rise in cancer in dogs is almost entirely due to the toxic ingredients commonly used in pet food and pet treats.
I turned 19, I got Ula, my first Rottie. She was my partner. Everybody knew us, Ursula and Ula. She was a phenomenal dog. And I did everything right with Ula, or so I thought. I spayed her very young before her first heat. I got the best commercial dog food on the market. I exercised her a lot. I thought I was doing absolutely everything right. I did her vaccines on time every single year, never skipped a beat, because I love my dog so much and I wanted to do everything in my power to have Ula live longer. And then Ula was diagnosed with bone cancer when she was 9 years old. I didn't even know that Rottweilers or dogs got cancer. I was absolutely beyond devastated. Like, there's no words that could ever describe the pain and how upset I was when Ula got diagnosed with cancer. She was such a huge part of my everyday life. And so now all of a sudden my dog that seems so healthy and vibrant, and I thought I had done everything right, has bone cancer. And now I have to figure out how I can fix it and if I can give her the best amount of time and, most importantly, quality of life. But that is when I started studying. I got every book I could on cancer and dog cancer, and I got books on nutrition and all these things, and I thought, oh my gosh, cancer loves sugar, cancer loves starch. I eliminated it. This is when I started to do a fresh diet for my dog, and I started raw. And when I found out that that lump was cancer, I, of course, immediately, went in and had an appointment with an oncologist. And they removed 3 ribs, and they put the largest piece of carbon fiber in a dog that they have ever done. We started chemo, and that's when I met Dr. Villalobos, and she was great. She could see how much I truly love this dog. I didn't want to do chemo and make her sick. I wanted Ula to be Ula. So I would drive 2 hours with Ula several days a week to split up the chemos in smaller doses, which was what Dr. Villalobos had suggested.
It's called metronomic chemotherapy. That timer on the piano, that metronome that clicks back and forth. Well, that's what they named this chemotherapy after. It's called metronomic chemotherapy. So it's daily, but it's a very low dose. And what it does is it attacks the angiogenesis, which is the formation of new capillaries and new little tiny blood vessels that feed a growing tumor.
Ula never got sick. She had no side effects. As a matter of fact, after we get done with chemo, she had to stand the whole way home in the back of my car and look out the window with me. Her spirit, she was so inspiring because she never felt sorry for herself. She never knew she was sick, really. They never had to put her under for anything. She was so good. And a lot of times she wanted to go to the beach after having a session of chemo, which was just a crazy thought. But we would go to the beach. She'd spend 2, 3, 4 hours if she wanted at the beach, and that was amazing to see her live like that. I feel that if people could be more like dogs, we would have a much more peaceful society. I mean, think about it. There's so much that we learn from our dogs. No matter what, they're always happy to see you. Even if they're not feeling well, they'll comfort you. And my mom made a really good statement that stuck with me and I have passed on. She said, Ursula, you have to stop. You have to be strong for Ula, because Ula needs you right now. Ula needs you. And if you're crying, she wants to take care of you. It's your turn to take care of her. And I think so often we think we take care of our dogs, but when we lose them, we realize that they take care of us. And they never live long enough. So there's so much we can learn from our dogs. I got Oscar when Ula actually had cancer, and I was gonna do everything in my power to make sure that what happened to Ula doesn't happen to Oscar. With Oscar, there were a lot of things that I changed. I added raw food into the diet, and I had learned about supplements, so he got certain supplements. I titer tested him only, I didn't vaccinate him. After his puppy shots, he never needed another vaccine in his life. Even though I had changed so many things with Oscar, he ended up being diagnosed with a cancer called hemangiosarcoma. And Oscar's spleen had ruptured. So I started with chemo, and it wasn't right for Oscar. So I used something that's it's kind of a controversial because there's no FDA studies on it, but it's called neoplazine or black salve. So I would make meatballs and I would put the neoplazine in, and I was doing a fully raw diet. And when he had his 6-month checkup, no cancer. No cancer. When you look at the longest living dogs, the 3 longest living dogs, their diets were all fresh. just cut up an organic piece of lamb shoulder here. I'm gonna do Lena's meal first. Stainless bowls, never use plastic. I feed her about 2.5 pounds a day. This is great for cleansing teeth. And this is an organic gizzard from a turkey. Liver should always be organic. I'm gonna add just a little bit of tripe. This is green tripe. And then I make bone broth. I have some bone broth. I make these bone broth in cubes. And I'm going to add some fresh blueberries, raw cow kefir. So this is like a super probiotic, far better than over the counter. So I add that. So this is dark leafy green. This is curcumin. I make it in a paste form. The most powerful anti-inflammatories. It's anti-cancer, it's antibacterial. So this is Lena's meal. And you know what's so great about this is that I know what I'm doing is giving her the energy that the food that energizes her system and builds a stronger immune system. She's obviously very excited.
The doctor said we didn't have much time. The cancer would spread into other part of his body. We had to make a decision. Ursula gave my mommy a lot of helpful information, but my mommy wanted to try one more thing. Stereotactic radiation.
One of the newest things is to use what's called stereotactic radiation therapy. So basically the way that works is that no surgery is needed for that, but you're performing radiation therapy that primarily targets the tumor by rotating the beam around the limb. And so that way you can give a much larger dose without compromising the tissues that are usually compromised when you don't use this advanced technique.
It allows us to do a CT scan. We take the original CT scan that the plane is made off of, take one right before the treatment, and we have a software program that allows us to overlay them.
Samson came home from the hospital, and we gave him a lot of love. It was going to be a long recovery. I don't think he liked his new green food that much, but he ate it anyway.
There you go.
I tried to imagine not having my dog. I would be very sad. Dogs make people happy. They help people in many ways. Maybe Samson can be a therapy dog. Maybe he can work with children as a reading therapy dog.
Studies have shown that kids that are reluctant readers or slow to learn to read do much better when they read to the therapy dogs. The dogs don't make fun of them. The dogs are non-judgmental. So the kids feel more relaxed in that setting reading to the dogs. And studies have shown that their reading levels have pretty dramatically increased when they have a program like this in the school or a library.
Carl and the baby duck.
Mama duck goes one way to look for baby duck.
Every time they know the dog is here, they just get so excited. They love having the dog here. And even children that are a bit shy or a little bit uncomfortable around dogs, they warm up to Spencer right away.
They really love Spencer. When he's not here, they're a little disappointed. Having the dog there is a little bit of a confidence booster for them. Instead of reading to an adult or to a human, it feels like it's a little bit easier to read to an animal or a dog.
And so often, children that are hesitant readers do feel very uncomfortable reading aloud in front of their peers, or especially in front of adults. So by reading to the dog, it helps them to feel very comfortable, because Spencer doesn't judge mistakes, he doesn't judge fluency or speed.
There's something about animals, whether it be their presence, whether it be their kindness. There's something about them that make a human, especially a human who may have problems with emotions, it really helps kind of settle those feelings that may cause uneasy feelings. And for some reason, it just makes the entire environment, atmosphere, warm and more welcoming.
Their behavior sometimes can be difficult for them to control, and Spencer kind of helps them because they know they have to wait their turn to read to him, so they learn patience, and it's very beneficial.
Ooh, good job. Yay, Spencer! Woohoo!
It usually takes us about a half an hour just to get to her room when we get there, because all the folks see us come in the door and they all come over and want to pet Spencer, and they like to tell stories about the dogs that they used to own before they were in assisted living. So we visit with just about everybody in the facility. They all know Spencer and Tommy and Stogie, because we take all our therapy dogs there and we visit with everybody, even the staff. I think the staff benefits just as much from these visits as the residents do. It's a very positive, uplifting experience for folks, and studies have shown that it actually lowers blood pressure, especially the folks that are in the hospital setting where they might be under a lot of stress, or they might be having pain, or might have bad news. They have shown that these dogs actually can reduce their blood pressure, and it helps folks to focus again and be more positive. We've seen that ourselves, the dramatic impact that these dogs can have. Spencer won American Red Cross Heroes of York County Award 2 years ago for his pet therapy work. Benny was my first therapy dog, and he was the first reading education dog here. He was a cancer survivor. Benny was diagnosed with osteosarcoma at 5 years of age, and we were lucky enough to find an angel up at Cornell University, a surgeon who was willing to work with us to save his leg. And we did limb spare surgery for him, and he did just fantastic. It was a long, long ordeal, many, many surgeries and chemotherapy, but Benny did fantastic. And I needed to find something for him to do after his recovery, because our other dogs were out at dog shows and going to obedience events, and he felt left out. And that's where I came upon the pet therapy work for him. And he was just fantastic. He was so careful and intuitive and just wonderful with everyone.
In the category of therapy, here's Benny.
When they noticed he had that brace on his leg, of course it started a conversation about what was going on. And when people heard he was a cancer survivor, it just opened up so many doors, and it just inspired people, because here was a dog who had cancer, but he was out working and helping to inspire other people. And it was just, he was just phenomenal. But he succumbed to hemangiosarcoma. When he was diagnosed with that, we knew there's just no cure for that. It was just devastating. When he passed away, he was just over 10. And I didn't think I could do this again after losing him, because he was my heart. But everybody kept saying, well, why don't you give Spencer a chance? And I was like, I just didn't think I could do it. But I went back out with him, and he's so much different than Benny. But that's not a bad thing, because everybody's different. But Benny was so careful and calm, and Spencer was just gung-ho and trying to make people laugh. And so it was quite an adjustment for me, but he's been phenomenal. But Benny was the first Rottweiler to win the American Kennel Club's Award for Canine Excellence for pet therapy, and he got the American Rottweiler Club Anvil and Merco Awards, and the Colonial Rottweiler Club Seeger Award. So he was just so special, and he was what started us down this path.
Good boy. My first Rottweiler was Eric, And I've had 2 Rottweilers, one Eric and one Jake, and now I have 2 sons, Eric and Jake. So most people, I think, name their dogs, you know, after other people. I name my children after my dogs. Allowing Gunther to do his therapy work in our pediatrics, in our ICU, you know, some of the areas where more challenging, is probably the most rewarding. Gunther loves his Atlantic Care nurses, and they love him. I mean, when they see him, I will tell you, they're generally pleased, and there's not a day that goes by that I bring Gunther from time to time to work and I allow him that opportunity that you don't hear somebody, I needed that. I just needed that. And I started realizing that not only was he good for patients, but I was shocked at the amount of decompression he provided, especially for our nurses.
Good morning, I'm Dara Brown. There's breaking news at this hour from Orlando, where there are reports of a shooting at a nightclub in that city.
One of the more challenging events that we had to respond to was the tragedy in Orlando after the events of Pulse. And what we had done, I belonged to an organization called the Tri-State Canine Crisis Response Team. As much as I've had 27 years in the state police, I've never been impacted as emotionally as I was when I went down there. And the role that Gunther and some of the other canine teams provided was incredible. I will tell you that we went to Pulse. We were right outside the nightclub. We spoke to a lot of people who were themselves, you know, personally impacted by the event, whether it was they were present or whether it was their family or loved ones actually may have been taken from them. It was just a matter of Gunther sitting with them and allowing them to just, you know, hug him and pet him. And the emotions I saw, we went to the 49 Cross Memorial that was set up not too far from Pulse nightclub. Extremely emotional. The still images and the crosses that were there. And we just, you know, arrived and we allowed people who were there the opportunity to interact with our canine teams. And I can't begin to tell you how many people came up and just hugged Gunther. Maybe didn't even say anything because there were tears in their eyes. And the role that Gunther played with the entire group of firemen was phenomenal.
Everything was going great with Samson's recovery. Then one day my mommy came home with bad news. The doctor found another tumor in Samson's front leg. The cancer was spreading inside his body. My mommy said they did everything they could, but it was time to say goodbye. We didn't want Samson to suffer anymore. My sister and I wrote Samson a letter, thanking him for his friendship. Then we said goodbye. There's a place called Rainbow Bridge. It's a bridge that connects heaven and earth. Dogs go there when they die. The the sick and injured dogs are made healthy again. And they play all day long. Then one day they see you. You have arrived. Your dog will run to you, and you will both cross the bridge together, never to be separated again. Dogs mean many things to many people. What does your dog mean to you?
Dogs are so loyal. These are more than working dogs for me. These are my friends. And when you're out there in the wild and you're with your sled dogs, there's something almost numinous about that.
They're working dogs. They want to work, they want to be with you. They are not dogs to put outside. They are dogs that are part of your family. We are best friends, so we are finding new things in this world that we can do together.
If you've ever had a friend who was always there, who didn't judge you, who wanted to be with you and do things with you, and was always just happy to be around you, that's how I would describe these dogs. They're just loving dogs, and they're good companions, and they're supportive of people. You can go out tracking or something else and have a bad day. They don't really necessarily remember that. They go out the next time and they're willing to try again.
They're smart. They have a lot of energy. You can work with them. You can do almost any sport you would want to with them, whether it be obedience or agility or carting, whatever, nose work. I mean, I love that about the dog, that they're so flexible and what they're capable of doing and what their desire is to do.
They'll never lie to you. And they only have this positive drive. They just want to be comfortable and enjoy life. So just taking a step back and watching for the subtle cues, because they'll tell you everything you need to know about what they want. You just have to be open to watch for it.
We can make those dogs feel better, and we can help people take care of their dogs at home in a way where they can really stay bonded together.
My favorite time with Brutus is just the quiet times. It's the simple times. I mean, it's fun to work with him and to teach him tricks and all of that kind of stuff, and to go on walks and everything. But my favorite time is when you know that he is happy just to be next to you. I think we're people that our dogs are our children, and we love them no matter what, and we would do anything for them.
I love how stoic they are, their loyalty, their affection. Their love is like no other. When you have a bond with your Rottweiler, I've had dogs my whole life, and I love all dogs, but there's something special about the Rottweiler.
There's a lot of informed pet owners out there. They've had cancer or hospice with their family members, or they come in with a previous history of a pet that had cancer. And people are expecting kinder, gentler treatment for cancer. And I think that there's a big willingness to search for the right combination of treatment.
But you always have to be one step ahead of these guys because they are so intelligent, and it really keeps you on your toes. So we just love the versatility of this breed.
For the companionship, for the love they will give you, and for the friendship you will always have, there's nothing better than having a canine. There's nothing better than having a Rottweiler.
say your role is in his life?
To love him. To keep him safe, to keep him happy, to give him everything that he could possibly want. Yeah.
This is Bodie. His name means Path to Enlightenment. We will always remember Samson, but we sure are happy to have a dog again. I hope someday there will be a cure for cancer. Maybe I will be the one to find it.